These moments of relief now appear temporary. The virus's newest form has arrived in India. And this is where the early cases of Omicron were found. We've been given rare access to India's leading genome sequencing facility.
Which is this lab?
They're testing 5 times more samples since Omicron appeared as the government tries to contain it. Here, they're isolating the virus. Then it's fed to a machine.
And we can able to tell that whether the sample is having Delta variant or Omicron variant.
So it's here basically that we can determine what form the coronavirus is going to take. It's the information from labs like these that will aid policymakers to make decisions that can mitigate the impact and at the end of the day can help save lives.
During the second wave, India was criticized for not alerting the world quickly enough about the Delta variant. Has anything changed? I asked this institute's head.
We have learnt a lot from our experience of earlier in the year, and I think we would be much more proactive, much more, prepared.
This is the trauma India lived through. People were left to fight the pandemic on their own.
Balaji!
Outside a hospital in Delhi, a woman tried hard to revive her brother. He died minutes later, before a doctor could see him. Inside hospitals, doctors and nurses worked day and night as the sick kept coming. They squeezed in extra patients even into intensive care. Here, between looking at his patients, we saw Dr Sumit Ray frantically trying to get oxygen supplies for his hospital.
We are running out of oxygen. The whole country is running out of oxygen, okay?
Hi, Dr. Ray. It's so good to see you.
I met him for the first time since then.
It was the worst period ever in my life in terms of as a medical professional. Obvious feeling is that sense of dread and anxiety building up. We are just starting to see an uptick in the number of patients. These are double vaccinated people starting to get infection again. So time to be very, very careful, yeah.
Travel restrictions and testing at airports has been reintroduced. But that's not enough, says Dr Swapnil Parikh.
If we are to get hit by a third wave fueled by the Omicron variant, preparation for that needed to start yesterday, not tomorrow, not day after. In this country, we've played pandemic roulette where we took a wait and watch approach for the second wave, and we lived it. We saw what happened. So let's try and do the opposite this time. Let's over-prepare.
Half of the country's adult population is fully vaccinated, but hundreds of millions are still vulnerable. If the virus spreads rapidly in any country, it can mutate further. That puts the whole world at threat. Yogita Lamai, BBC News, India.